Welcome to Take Action Naloxone Training, a continuing education offering developed by the Overdose Prevention Engagement Network, O.P.E.N., and its partners. The Overdose Prevention Engagement Network, O.P.E.N., is a diverse team dedicated to improving lives and reducing harms of substance use. By engaging with individuals, communities, and organizations, we share education and resources to strengthen person-centered prevention, treatment, and recovery. With an overarching goal of developing transformative, evidence-based solutions to reduce harm and stigma surrounding substance use, we work to support healthcare providers and communities in understanding and addressing substance use disorders at every level. After this training, you will be able to 1. Recognize and respond to opioid overdoses. Learners will be able to identify the signs of an opioid overdose and take appropriate, timely action using the action steps. 2. Understand naloxone use and administration. Learners will understand the different forms of naloxone, how to store and administer them safely, and know when repeat dosing is necessary. 3. Promote compassionate, harm reduction practices. Learners will apply principles of harm reduction and compassionate care, including reducing stigma, supporting individuals during recovery, and understanding legal protections for responders. Here's what you can expect to learn. This training will teach you how to compassionately respond to an opioid overdose and support people who use drugs. We're glad you're here. Together, we will explore why it is more important than ever to know how to recognize and respond to an overdose. Your willingness to learn these skills today could save a life tomorrow. Our nation is currently in the midst of an opioid epidemic and overdose crisis. In 2023, an average of 287 people in the United States died every single day from a drug overdose. That's more than 10 people every hour. These aren't just numbers. These are neighbors, coworkers, friends, and family members. To understand where we are today, it helps to look at how overdose deaths have changed over time, largely driven by shifts in the drug supply. The first wave began in 1999, fueled by the rapid increase in prescription opioids. These medications were promoted as effective pain treatments with supposedly fewer risks. The second wave began when many people who had become dependent on prescription opioids turned to cheaper and stronger alternatives like heroin. By 2015, prescription and heroin-related deaths leveled off. But then the third wave began, fueled by fentanyl, a drug 50 to 100 times stronger than morphine. Fentanyl now accounts for most overdose deaths. Today, we're experiencing a fourth wave, marked by rising stimulant-related overdose deaths, often in combination with synthetic opioids. The good news is that overdose deaths are finally starting to decline, both in Michigan and across the U.S. But the crisis is far from over. It's important to know that 80% of overdoses happen inside a home, and in about 40% of cases, a bystander is present. This means there are countless opportunities for prevention if people nearby know how to act. The even better news is this: opioid overdose deaths are preventable. Naloxone, also known by the brand named Narcan, is a safe, easy-to-use medication that can reverse an overdose and restore breathing. This training will help you understand overdoses, learn how to use naloxone, and practice the steps of taking action, so you feel prepared to save a life. Before we can talk about how to respond to an overdose, it's important to understand what opioids are and how they affect the body. Opioids are a type of drug with powerful pain-relieving properties. They can include medications prescribed by a doctor or unregulated drugs. Opioids are made naturally from opium poppy plants or chemically manufactured in labs. There are three main types of opioids. Each has medical uses, but also carries risks of addiction and overdose. The first type of natural opioids, which are derived directly from the opium poppy, such as morphine and codeine. Natural opioids are the least processed. Next, semi-synthetic opioids are created in labs from natural opioids. They modify the compounds of natural opioids for stronger or more targeted effects. The third type is synthetic opioids, which are completely lab-made. Synthetic opioids are often much stronger than other opioids because they bind more effectively to receptors in the brain and nervous system. Opioids are mainly used to relieve pain, but they also help treat opioid use disorders and suppress coughing. Even when prescribed by a doctor, opioids can be harmful if misused. Misuse might include taking more than prescribed, taking them more often than prescribed, or using opioids that were not prescribed to you. Most people using prescription opioids as directed do not become addicted. However, young people are at higher risk due to brain development, and improper use increases both addiction and overdose risks. Opioids can be taken by inhalation, such as smoking or snorting, orally via pills, by injection, or by boofing. Opioids reduce pain and can cause intense feelings of happiness. When opioids enter the body, they travel through the bloodstream and bind to opioid receptors in the brain and nervous system. This blocks pain signals, which is why opioids are effective after surgery or injury. Opioids also affect the brain's reward system, creating feelings of euphoria. Over time, the brain may rely on opioids to feel pleasure, increasing the risk of addiction. As tolerance develops, higher doses are needed to achieve the same effect, which raises the risk of overdose. Opioids can cause a range of effects, including drowsiness, dry mouth, slowed breathing, muscle weakness, a warm sensation of the skin, nausea, and constipation. Not everyone who uses opioids will become addicted, but risks increase with higher doses, longer use, and certain personal or genetic factors. To minimize risks, always follow your healthcare provider's directions and discuss the benefits and risks of opioid use openly. Each type of opioid varies in strength and how long it lasts in a person's body. Heroin can last in a person's body for 30 minutes to 6 hours, while methadone can last for 8 to 130 hours, and fentanyl for 3 to 7 hours. Fentanyl is an extremely strong synthetic opioid, much more potent than heroin or morphine, so even a tiny amount can be deadly. Its high strength also makes it easier for the body to develop tolerance and dependence, increasing the risk of addiction and overdose. But what is deadly? We don't truly know. Because opioids differ in strength and people metabolize drugs in different ways, it is impossible to know exactly what amount is fatal. This unpredictability makes every opioid use potentially dangerous. The unregulated drug supply adds even more risk. Drugs may contain unknown substances or lethal amounts of fentanyl. Users often do not know what their drugs contain, and combining substances increases overdose risk. Most fatal overdoses involve multiple substances. Fentanyl is now commonly found in the unregulated drug supply, often mixed with other drugs such as cocaine or methamphetamine. Just 2 milligrams, the same amount of roughly 10 to 15 grams of table salt, can be fatal. Quick response may require additional doses of naloxone. Because fentanyl cannot be seen, smelled, or tasted, fentanyl test strips are important tools for detecting its presence safely. Other non-opioid substances are also showing up in the unregulated drug supply. Xylazine, a veterinary tranquilizer, can mimic the signs of an opioid overdose, but is not reversed by naloxone. It can amplify the effects of other depressants like fentanyl. Medetomidine, another veterinary anesthesia, has also been found in unregulated drugs. Like xylazine, it is not reversed by naloxone and can cause longer-lasting sedation and pain relief. Now, let's hear some common misconceptions about overdose from people with experience, as these myths can prevent timely, life-saving action. In this Take Action Recovery Roundtable discussion video, people in recovery will respond to common misconceptions about opioid overdose.
I would say that this is a fallacy. We can prevent people from dying from a drug overdose in any situation, not just whether the drugs are used in private or in public?
Yeah, I was revived a couple times by paramedics when people that I was using with called 911 when they saw me overdose. And so, you know, using alone, it does happen. I don't see that as a good reason to not get Narcan in the hands of as many people as possible. It presents an opportunity to save a life.
Mm-hmm.
The myth is that if you help people stay alive, that somehow they're gonna just use in a more risky way because they're using for fun. And my experience in myself and with a lot of people who have addiction is that we're not choosing to use, we're using because we can't not use. It's that loss of control piece that's missing from this. Delaying entry into drug treatment is also a myth, and I think every time that someone is revived with naloxone, it presents an actual opportunity to help them get into treatment rather than a barrier to treatment. So I think, you know, this statement is all wrong.
I'm with you on that also, Matt. It's almost to the same fashion as eating. I mean, when it's ingrained so hard into us that at some point that switches off and turns into a need, into a basic need, into like the survival.
This is not something that we started out with when we were children and said, hey, I would love to be addicted to heroin. What a great life this would be. This is not how it goes.
It's true. I think the moral of the story for me, in my humble opinion, is that addiction is not a moral failing. It is a disease. This is a disease we're dealing with. It's not a moral failing. It is something in our brain that is inherently wrong, that is going on with us. And with treatment, it can be corrected. I'm against this statement. I don't think it's a waste of resources. I believe that the resources are generally finite, but life is not, and life is valuable. And I believe that whatever can be used to implement, whatever tools we have to implement saving someone's life from an overdose should be employed. Absolutely.
And for me, if somebody would have stopped it for the first or second time they used naloxone on me, I wouldn't be here with you guys today. This statement is very false. You know, we got to get out there and try and keep trying with these folks, and it's just completely false.
Yeah, I feel like this is an absurd statement. Imagine if we said, we're not gonna do CPR on that guy is choking or whatever because he choked before, or we're not gonna use this defibrillator on this guy who's got heart problems because we've done it a couple times and he's got more heart problems. And so this is rooted in some idea that addiction is a moral failing as opposed to a medical issue. And so, you know, I think that's the root of these myths.
Absolutely.
Sure.
Yeah.
In this Deputies Discussing Myths video, law enforcement officers respond to common misconceptions about opioid overdose.
Usually we won't, because due to the Good Samaritan Act, we can't arrest the person who called for help on an overdose. They can't be charged with the possession of narcotics.
It's not a priority to arrest somebody because the first thing is they need treatment. That's the goal of getting somebody help when they're having an overdose, is getting them to the hospital and helping them out. So it's not a priority to arrest somebody.
I think the Good Samaritan Act needs to be better publicized, because a lot of people I've dealt with on scene don't realize that we're not going to charge them, and they won't be honest what they've taken, or their friends won't tell us what they've taken, so we can't get the proper help.
And all the time that I've administered Narcan or been on scene when someone did, it's never been violent. They wake up kind of groggy, tired, kind of out of it, or confused.
Now, see, back when we used to use it intravenous, when HVA would show up and use intravenous Narcan, there was a more rapid response and it was a lot more violent. Since we went to the nasal stuff, it's been great.
That's definitely not true. One of the first things somebody wants to do is, of course, dial 911 and start getting help on the way. You know, do whatever you can to try and get somebody some help until 911 paramedics get there, till they can get some medical treatment. But there's plenty of things that you can do. One of the things you don't want to do is leave them alone.
I mean, an overdose is an extremely deadly situation. I've had subjects that I've made contact with that have no pulse. They're not breathing anymore, but due to me being there, I was able to bring them back and they're still alive today. Had I not been there, it would have been a wrap for them.
Yeah, the naloxone, the rescue breathing really helps until HVA can arrive and transport. EMS should respond as well. I mean, we can usually beat EMS by minutes, and with the naloxone that we are all issued now, we can usually get the life saved before they even arrive. Still important each EMS shows up to transport, but other than that, we can usually beat them and reverse the overdose before they even get there.
I agree. Most of the scenes that I've been on were there, like you said, minutes possibly before the ambulance gets there. Like you said, with us being able to administer the Narcan, start rescue breathing if needed, they're kind of just ready to load up and go when HVA gets there or the EMS gets there.
And this is a team effort. So it's law enforcement, it's medical staff, and it's even the citizens that called to help this person. So, you know, we're not just showing up there to put some handcuffs on somebody. We want this person to get treatment and get recovery.
Beyond emergency response, there are harm reduction strategies we can use every day to prevent overdose and keep people safe. Harm reduction offers a compassionate, person-centered approach to public health and individual well-being. On an individual level, it is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. On a societal level, it is a movement for social justice built on a belief in and respect for the rights of people who use drugs. Harm reduction is a strategy to support people who use drugs by focusing on safety and overdose prevention rather than judgment. Not all people who use drugs are ready to stop or enter into treatment, so it is important to meet people where they are and promote safer practices when possible. The core values of harm reduction are respect, dignity, and compassion for people who use drugs. Meeting them where they're at fosters engagement and trust. Harm reduction is recognized worldwide by the World Health Organization, Centers for Disease Control and Prevention, and many other organizations. Examples of harm reduction efforts include naloxone distribution, distribution of safe use supplies like safe snorting or smoking kits and sterile syringes, drug checking services like test strips and Fourier transform infrared spectroscopy, distribution of wound care supplies, and treatment with medications for opioid use disorder. Key harm reduction messaging to prevent overdoses includes: always make sure to carry naloxone. Don't use drugs alone. Train your friends to call for help and stagger use within a group so others can respond or call for help if needed. Go slow and be aware of tolerance changes. Do not mix drugs. If you have to use alone, call a hotline so someone can monitor you and help you stay safe. Why are these harm reduction practices important? Because these interventions have been proven to save lives, be cost-effective, reduce blood-borne illnesses, and help to engage and establish trust with people who use drugs. Harm reduction isn't just related to drug use. We use harm reduction strategies to create everyday safety. Wearing sunscreen, using seatbelts, or having a designated driver are just a few common examples of harm reduction. Harm reduction success is defined by any positive change and can look different for different people. Some examples of success could be stopping drug use, using less or less often, using safer injection practices, accessing tools for safer use, assisting access to healthcare and housing, feeling comfortable talking about their drug use, establishing new friendships and networks. Let's learn about risk factors for overdose. Knowing who is at higher risk can help prevent overdoses. Overdose risk factors are characteristics or behaviors that increase the likelihood of experiencing an overdose. Some situational risk factors include variation in strength and content or purity of street drugs, or strength and dosage of prescription opioids. Switching mode of administration, such as going from snorting to injecting, or from taking pills to snorting. Tolerance changes, which can be caused by resuming use after a period of abstinence. Common scenarios include using after getting out of jail or leaving treatment. New and experimenting users where no tolerance has been developed. Using more than one substance. Using alone where no one can help you. Recognizing these factors can help you anticipate risk and act quickly to prevent harm. Experiential and historical factors can also influence overdose risk. These include history of substance or tobacco use, which is highly predictive of future risk. Family history of substance use disorder. Genetic factors may contribute. History of pre-adolescent sexual abuse, as trauma can increase risk through PTSD. Self-reported craving, which indicates desire to use and continued risk. Demographic factors, like being a younger age and male, which may correlate with higher risk-taking. Psychiatric history, including depression or other conditions, may influence opioid use. Understanding these personal and historical factors helps you provide targeted support and intervention. Now that we understand the risks, let's focus on recognizing an overdose and responding effectively with naloxone. An overdose can happen very quickly. When opioids enter the bloodstream, they bind to receptors in the brain and spinal cord, slowing breathing. Less oxygen reaches the brain, and the person may become unresponsive. If untreated, this can lead to death within minutes to hours, depending on the drug and individual tolerance. Signs of an opioid overdose include very slow, irregular, or no breathing, blue, purple, or gray lips and fingernails, unresponsiveness to pain, such as a sternum rub. Other signs may include pinpoint pupils or snore-like gurgling sounds. Recognizing these signs quickly is critical to saving a life. Fortunately, naloxone can reverse an opioid overdose. It works by blocking opioids from the brain's receptors, stopping overdose effects. Naloxone can be injected or inhaled. It is safe for pregnant people and children and has a shelf life of 4 years. Naloxone only reverses opioid overdoses and will not have any effect if the person does not have opioids in their body. Carrying naloxone and knowing how to use it gives you the power to save lives. This video demonstrates how naloxone works in an overdose situation. Watching it can help you understand what is happening in the body during an overdose and how naloxone can help save a life.
Opioid overdoses happen when a dangerous amount of a drug, like heroin or fentanyl, are in the body. When someone takes an opioid, the drug binds tightly to the mu-opioid receptors in the brain and spinal cord. When too many opioids are bound to the receptors in the brain, it dramatically slows the body's ability to breathe, leading to a lack of oxygen. With a lack of oxygen to the brain, a person will become unconscious and unresponsive. Breathing will stop, then the heart will stop, leading to death. This process can occur seconds to minutes to hours after drug use, depending on the type of drug. Naloxone is a medication that can be used to reverse this process. When administered through a nasal spray or injection, naloxone molecules enter the brain. Because the naloxone has a stronger affinity to the mu receptors than the opioid itself, it kicks the opioids out of the receptors and occupies it. This allows the person to start breathing again. Though naloxone knocks the opioid off the receptors, the opioid remains in the body. Many opioids last several hours, while naloxone is only effective for 30 to 120 minutes. This means a person may experience another overdose after the effects of naloxone have worn off. Therefore, it is very important to continue monitoring the person and seek medical care. Want to learn more about naloxone? Visit our website for education, resources, and opportunities to get involved.
Naloxone acts quickly, often restoring breathing within 2 to 5 minutes. If needed, repeat doses can be given every 2 to 3 minutes until the person's breathing resumes. Because naloxone's effects last 30 to 120 minutes, continued monitoring and medical attention are essential after administration. Responding quickly to an overdose is key. Remember the acronym ACTION, A.C.T.I.O.N. To respond effectively, follow the action steps. A. Arouse. Try to wake the person with the 3 S's: shout, shake, or sternum rub. C. Check. Look for signs of opioid overdose, such as slow breathing and/or blue lips. T. Telephone. Call 911 if safe. Tell dispatch it's an overdose. I. Intranasal intramuscular naloxone. Administer immediately. O. Oxygen. Provide 2 rescue breaths or CPR if trained. N. Naloxone again. Repeat every 2 to 3 minutes if needed. If the person vomits or you must leave briefly, place them in the recovery position on their left side. Stay until help arrives. To administer the naloxone nasal spray, peel open the packaging. Place the tip in the person's nostril and push on the plunger to release the medication. No test spray is needed. This video shows how to respond to an overdose following the action steps.
Opioid overdose death is preventable. Opioids include prescription pain medications and street drugs such as heroin and illicit fentanyl. You're at a higher risk for an overdose if you had a prior overdose, have a history of mental health and substance use disorders, mix drugs with opioids such as alcohol, benzodiazepines, cocaine, and other substances, have not used drugs for a period of time because you were in jail or in a detox facility and experienced a change in tolerance, taking higher dosage of opioids or on long-acting opioids. However, with a few steps, you can take action and save a life. Action means arouse the person, check for signs of overdose, telephone 911, intranasal or intramuscular naloxone, oxygen, naloxone again. If you suspect an overdose, first arouse the person with the 3 S's. Shout the person's name and shake the person firmly by the shoulders.
Ned, honey? Ned! Come on, Ned! Ned!
If there is no response, do a sternal rub.
Come on, Ned!
Ball your hand into a fist and rub against the breastbone of the person.
Ned, wake up! Come on!
If there is still no response, you may have an opioid overdose on your hands. Check for signs of an overdose. Signs of an opioid overdose include blue or grayish lips or fingernails, slowed or no breathing, deep snoring or gurgling noises, pinpoint or tiny pupils, unresponsiveness to pain, unconsciousness. If one or more of these symptoms are present, telephone 911.
Hi, I think my boyfriend overdosed.
Cooperate with the 911 dispatch operator to get help on its way. In Michigan, you're protected from liability in the event you administer naloxone in good faith for an opioid overdose or call for help for someone who is overdosing. Stay on the phone with the operator. Once medical attention is on its way, it's time to move along to the next step. Intranasal naloxone. In order to administer naloxone, peel the intranasal naloxone medication. Place the nozzle into the nostril and push the plunger into the person's nostril. Remember, do not push the plunger until the nozzle is in the nose. No test spray is needed. The next step is to provide oxygen through rescue breathing, CPR, or follow 911 dispatch instructions until medical help arrives. The last step is naloxone again. Repeat naloxone every 2 to 3 minutes till the person resumes breathing or becomes conscious. Continue rescue breathing and/or CPR while waiting for naloxone to work. Stay with the individual until help arrives if it's safe to do so. If you must leave the person unattended, Place the person in recovery position with their head tilted back slightly to open their airway, hands supporting the head, and the knee stopping the body from rolling onto the stomach. Ultimately, no matter what happens, you did the right thing because you responded. Remember to take action to save a life.
This video shows how to perform rescue breathing. Watching both of these videos can help solidify hands-on skills for responding effectively.
For rescue breathing, place the person on their back. Place the face shield over the person's nose and mouth. Tilt the head back slightly and the chin lifted. Pinch the nose closed and place your mouth over the person's mouth to make a complete seal. Deliver 2 initial slow breaths until you see the chest rise. Then 1 breath every 5 seconds.
When someone is waking up from an overdose, it's normal for them to feel drowsy, confused, or disoriented. Speak gently and calmly to help them understand where they are and what just happened. It's important not to use harsh words or force them into treatment. Instead, focus on offering kindness, reassurance, and support if they need it. Sometimes friends or bystanders may also feel shaken. They may need comfort and support too. If you have naloxone available, make sure to leave some behind with family or friends. And remember, what matters most is that someone stepped in and responded. No matter what the outcome, responding was the right thing to do. Sometimes, when a person who depends on opioids receives naloxone, they may begin to feel withdrawal symptoms. This can be very uncomfortable for them. They might experience nausea or vomiting, diarrhea, chills, muscle aches, disorientation, restlessness, or agitation. They may also feel the return of pain that the opioid had been easing. These reactions are not their fault. They are a natural response to withdrawal. The most important thing is to stay calm, patient, and supportive, helping them feel safe and cared for as their body adjusts. Now, let's review the different forms of naloxone and how to use them safely. Naloxone comes in different forms, and one option is intramuscular naloxone, which is most often used by harm reduction agencies. It's the cheapest option, but it does require using a needle and syringe to inject into the muscle. If you choose this method, it's important to be comfortable with injections and aware of the small risk of needle stick injuries, which could expose you to infections. Another option is intranasal naloxone, which is commonly used by first responders and everyday people. It's easy and safe to use. No needles are needed, making it a very accessible option for most situations. While it can be more expensive than the intramuscular version, it's often covered by insurance or available for free through community programs and harm reduction agencies. Over-the-counter naloxone options vary in dose and price. The intranasal sprays are generally the most accessible for everyday use. Intranasal naloxone works best when it's stored safely. Keep it at room temperature or in the refrigerator, between 36 and 77 degrees. Try to avoid freezing or exposing it to too much heat or direct sunlight. If Narcan nasal spray gets too cold and freezes below 50 degrees, it may not spray properly or work as intended. If this ever happens and you need it, call 911 right away. If you notice it has frozen, you can warm it gently in your hands and let it thaw at room temperature for about 15 minutes before use. Caring for naloxone the right way helps make sure it's ready to save a life when it's needed. Let's review other naloxone products and learn about nalmefene. Higher dose naloxone formulations like Kloxxado and Zimhi are available, though there is no clear benefit to using these products instead of 3 to 4 milligram sprays. The New York Health Department studied law enforcement use of 2 different naloxone products, one at 4 milligrams and one at 8 milligrams between March 2022 and August 2023. They found no difference between the 2 doses when it came to survival, the number of doses needed, whether people became combative, and whether they refused to go to the hospital. But there was one important difference. People who received the 8 milligram dose were more than twice as likely to experience withdrawal symptoms compared to those who received the 4 milligram dose. This means there is no clear benefit to using the higher dose, and in fact, it may cause more harm than good for the person surviving the overdose. The key takeaway? The standard 4 milligram dose is effective and causes fewer complications. Nalmefene is not naloxone. Nalmefene is another opioid reversal drug with stronger, longer-lasting effects than naloxone. However, it can cause more severe withdrawal and hasn't been proven safer in real-world overdose situations. While nalmefene could potentially be a useful tool for reversing opioid overdoses, health professionals are advocating for a cautious approach until it has been more thoroughly studied. At this time, high-dose and long-acting opioid antagonists have no use in acute opioid overdose response due to the withdrawal symptoms they cause. Overdose response educational materials, instructions on overdose response, and training should emphasize the restoration of breathing, avoiding withdrawal, and compassionate post-overdose support and care. Knowing the current legislation helps protect both the responder and the person experiencing an overdose. Let's discuss. It is important to know your local laws surrounding overdose response to protect yourself and the individual who is overdosing. To check opioid laws where you are, use the Prescription Drug Abuse Policy System at pdaps.org. The Legislative Analysis and Public Policy Association, or LAPPA, website can help explain laws like civil immunity and the standing order. In Michigan, a person who administers an opioid antagonist to an individual whom he or she believes is suffering an opioid-related overdose and who acts in good faith and with reasonable care is immune from criminal prosecution or sanction under any professional licensing act for that act. Michigan's Good Samaritan law gives an overdosing drug user limited criminal immunity from possession charges and illicit use of controlled substances when seeking treatment for themselves or when summoning medical assistance for someone else. Note that this law does not apply if you have a felony warrant for your arrest, you are on parole, or you possess more drugs than for personal use. Compassion matters. Reducing stigma helps people seek help and accept naloxone interventions. Stigma is a negative assumption about a person or a group of people based on a specific belief or behavior. Addiction is a complex and multifaceted condition that affects millions of people worldwide. The journey of addiction involves changes in the brain's structure and function, particularly in areas related to reward, motivation, and memory. These changes create a profound compulsion to seek and use substances, despite a multitude of harmful consequences. This video explains how addiction alters the brain and ways to treat it through a multidisciplinary approach.
This video will touch on these topics. Addiction is a severe form of substance use disorder that is characterized by intense cravings and compulsion to use despite negative consequences. Structures and reward pathways in the brain are negatively affected by substances. This process is beyond a person's conscious control. Addiction can be treated using a multidisciplinary approach. What is addiction? Addiction is a treatable, chronic medical disease involving complex brain circuits, genetics, the environment, and an individual's life experiences. Most people who use drugs do not develop addiction. Environment and genetic components play a significant role in one's risk. Those who go on to develop addiction engage in use that becomes compulsive and continue despite harmful consequences. A key piece to understanding and treating addiction is recognizing how the brain's subconscious processes drive a person to keep using substances. The brain's reward system connects the areas of the brain that deal with motivation, pleasure, and behavior reinforcement. Each time a person uses an addictive substance, it causes a release of dopamine, a chemical messenger that reinforces feelings of reward, satisfaction, and a desire to use again, regardless of consequences. Additionally, Addiction involves changes in the prefrontal cortex, impairing decision-making and impulse control. The amygdala and hippocampus are also affected, contributing to the emotional and memory-related aspects of addiction. These neurobiological changes create a cycle of craving, withdrawal, and return to use, making addiction a persistent and challenging condition to treat. Let's dig deeper to understand how brain functions contribute to addiction. The brain's reward center receives dopamine from the ventral tegmental area, or VTA, which plays a big role in how we experience pleasure and motivation. Dopamine signals to our brains to repeat positive experiences. The hippocampus and amygdala connect emotions and memories to the things we experience. They can trigger strong urges to use substances. This emotional connection makes it hard to stop or resist using again. The prefrontal cortex is responsible for decision-making, self-control, and managing emotions and impulses. Drugs can damage this area. Behavioral therapy for substance use disorder often focuses on strengthening the prefrontal cortex to help control urges. The prefrontal cortex is the last area of the brain to fully develop. This is why teens are more vulnerable to substance use. Now let's put it all together. Normally, dopamine release is triggered psychologically by feelings of pleasure and released in the accumbens. Dopamine in accumbens then triggers the brain to want to repeat that pleasurable experience. When someone uses an addictive substance, these substances cause a direct release of dopamine, flooding the reward circuit up to 10 times more than natural rewards like food or sex. Even after tolerance is built up and the drug is no longer enjoyable, taking the substance still causes a release of dopamine and fuels an ever-intensifying desire to use again and again. When the brain's reward circuit is hijacked by addictive substances, a person's ability to experience pleasure from naturally rewarding healthy activities is reduced. This is one of the reasons people who struggle with addiction may be unable to enjoy things that were once pleasurable. Now, the person needs to keep using substances to experience even a normal level of reward. Larger and larger amounts will often be required to produce the familiar high. In addiction, cues from a person's daily routine or environment become linked with drug use, triggering uncontrollable cravings, even when the drug isn't available. These connections can last a long time, even when the drug hasn't been used in years. Let's review some key takeaways. Addiction is a severe form of substance use disorder, characterized by intense cravings and compulsion to use despite negative consequences. Structures and reward pathways in the brain are negatively affected by substances. This process is beyond a person's conscious control. Addiction can be treated using a multidisciplinary approach. Treatment medications. For example, treatment with medication is the gold standard for opioid use disorder. Therapy to rebuild areas of the brain damaged by addictive substances. Meaningful human connection, supportive relationships, and engaging in purposeful activities strengthen healthy reward pathways. Want to learn more about substance use disorder? Visit our website for education, resources, and opportunities to get involved.
Substance use disorder is a chronic medical disease that is listed in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, DSM-5, and requires ongoing medical treatment from a physician. Repeated drug use can lead to brain changes that affect decision-making, self-control, and the ability to resist intense urges to take drugs. Behavior is a symptom of the disease. People with addiction need the same medical care as people with other medical conditions like diabetes and heart disease. Be aware of your biases. 46% of U.S. adults say they have a family member or close friend who is or has been addicted to drugs. Again, check your biases. A common myth is that using naloxone will delay entry into drug treatment and encourage riskier drug use. Fact: naloxone availability does not encourage people to increase drug use or make it more likely that they will harm themselves or those around them. It has been shown to reduce self-reported drug use. Naloxone only enables the person experiencing an overdose to breathe. Dead people don't recover. There are many reasons why someone might first begin using drugs. They might be curious, want to fit in, perform better at work or school, feel good, or relieve pain. Try to understand the reasons behind the drug use. Where might the person be on this spectrum? Language plays a pivotal role in reducing stigma associated with substance use disorder by shaping perceptions, influencing behaviors, and promoting empathy. How we talk about opioid misuse and substance use can either contribute to or reduce stigma, making it crucial to use language that emphasizes substance use disorder as a chronic medical disease, not a personal choice or failing. A shift in language not only impacts how individuals with substance use disorder view themselves, reducing internalized shame and encouraging recovery, but also influences the attitudes and behaviors of healthcare providers, fostering more respectful, unbiased care. While there are many examples of words to use and words to avoid when talking about substance use disorder, here are some common words and phrases to consider. Use terms like person who uses drugs. Avoid terms like addict, junkie, drug abuser, druggie. Let's summarize the most important points from this training. Recognize signs of an overdose: slow or no breathing, blue lips, unresponsiveness. Take action. Arouse, check, call, administer naloxone, oxygen, repeat naloxone. Naloxone is safe, effective, and life-saving. Responding is always the right thing to do. Congratulations, you've completed this training. Your knowledge can save lives. Thank you for participating in this continuing education module. We hope you found the content valuable and applicable. For more educational opportunities, resources, and events, check out michigan-open.org.